Hi everyone, Dr. Microbay here. So there's been some buzz in the media about gastroenteritis in Jamaica, what's happening, the effects, and so on. Now, just to make it clear, I'm not here to discuss the political side of things. We just want to shine some light on what gastroenteritis is, the symptoms, how we treat it, and pretty much just a general overview of what it is. So let's get into it. So gastroenteritis is really a condition that causes inflammation of the stomach and intestines, and this tends to result in vomiting and diarrhea in the patient. Now, if you break down the word gastroenteritis, it will actually tell you what it means. So we're going to do a little medical terminology here, all right? So gastro means stomach, entero means intestines, and itis means inflammation of. Now, with medical terms, you read it from back to front. So itis would be inflammation of, entero is your intestines, and gastro is your stomach. So gastroenteritis means, reading from back to front, is inflammation of your intestines and stomach. Okay? All right. So gastroenteritis does not have only one cause, I should say. It may be caused by various things. These include viruses. It could be as a result of a bacterial cause. It could be because of a parasite. And just to mention a few of the viruses, so we have the calcivirus, there could be the morovirus, and the Rota Virus. And we're going to talk about the Rota Virus in a little bit more detail. There may be a bacterial cause, such as something known as Campylobacter. There may be a parasitic cause, for example, Giardia, or there's something, right? So it could be Giardia or Cryptosporidium, okay? So gastroenteritis may not only be caused by actual organisms, it may be caused by something that is produced by an organism, such as your bacterial toxins. So some bacteria produce chemicals, and these chemicals cause an irritation to the stomach and the intestines. These are known as your bacterial toxins. And an example of such a bacteria would be Staphylococcus aureus. And sometimes when we eat those nice potato salads that have been pre-made and improperly stored, that's the one for the money. So be careful of what you guys eat. All right, let's get into it a little further. So some of the common symptoms that a person who has gastroenteritis will experience include nausea, vomiting, diarrhea, upset stomach. They may have a headache, possibly a fever. They may have abdominal cramps or a tummy ache. Okay, these symptoms may develop or usually develop 1 or 2 days after being exposed to the causative agent. Now, if you recall, I mentioned the rotavirus earlier, and for good reason, because it is the most common cause of gastroenteritis, and this can be both in adults and children. It tends to affect children between the ages of 3 to 36 months, and the symptoms include what I just mentioned earlier. So this virus tends to flare up between the months of November to March, and it was once called the winter vomiting disease because those months are technically the winter months. So this virus likes the cooler months. So that would kind of explain why we're experiencing this flare up in Jamaica now, if it is indeed caused by the rotavirus. So when gastroenteritis is caused by a parasite, a virus, or a bacteria, it is known as infective gastroenteritis or infectious gastroenteritis. Now, you might be wondering how people come across this. How is it that my pitney get this thing? Or for those persons watching internationally, how is it that my child got this? Now, this is usually transmitted through the ingestion of contaminated food, fruit, or water. And this is usually through fecal matter. So the rotavirus tends to be transmitted through the fecal-oral route. So fecal-oral route. fecal matter being ingested. All right, it does not have to only be the rotavirus. For example, we have ingestion of improperly or prepared or undercooked meat, especially chicken, and non-potable water. So that is water that is not fit for consumption. So if you go to the bathroom, you do your business and you forget to wash your hands, and you go and prepare a meal, or you go and have food, or you prepare a bottle for your baby, then it could be that route that you introduce this pathogen to your child or whomever you're caring for. So after you change a diaper, after you look after an elderly or an ill person, you go to the bathroom, please ensure that you wash your hands properly, okay? So in order to properly treat gastroenteritis, you need to know what has caused this. So to diagnose it, a stool test may be done, a blood test may be done, along with other laboratory techniques, okay? So in order to properly treat, we need to know what is the cause. So you're going to do a medical history, you need to do a physical examination of the patient, etc. Now, to treat a person with gastroenteritis, the first thing that we tend to want to do is to ensure that the patient has adequate fluids. So if the patient is dehydrated, you're going to give them oral fluids. If they are severely dehydrated, then they need to be going to the hospital to get intravenous fluids. If the causative agent is a parasite, then an antiparasitic drug will be given to kill that parasite. If it is deemed that it's a bacterial infection, then antibiotics will be given for that. Now, things that prevent you from having the diarrhea, we tend to stay away from that unless it is prescribed by your physician, simply because if you take this medication, it's going to prevent what is supposed to go out from going out. So it's going to cause the organism or whatever it is to stay in your body and not be passed out as it should be.